Yeah.
Okay, thank you all for coming this morning. We have a lot of material to cover. I've asked Reverend Susan Maldry to open us in prayer, and then we'll get started.
Good morning, y'all. Let's go to God in prayer. Gracious God, we thank you for this beautiful day you've given us. We thank you for the people in this room and the calls that you put on our lives and those who walk faithfully beside us. God, we ask that you are in this place and with us as we talk about just retirement and the things that go along with that and the processes that are in place for us. We thank you for those that work tirelessly on our behalf. And we ask that in and through you, we will be strengthened for the journey ahead. In Jesus' name, amen.
Okay, let's go ahead and get started. Okay, so things for you to know. All eligible retired clergy and their spouses are eligible for the conference subsidy of $126 per person per month. The subsidy is only available to the retiree and spouse if they choose WPA-sponsored plans. If you go on our plans, we bill you the difference. We pay the $126, you're billed the difference. You can choose a Medicare plan outside of our plans. Keep in mind, you forfeit the subsidy, and you cannot re-enter our plans. If you want to ever look at our plans, please go to our conference benefits page to wpaumc.org/retiree healthcare. The grids and information are always out there, so if you're not sure about your benefits, please visit our webpage. It's always out there. If you have questions, you can call myself or my colleague Alexis. Come up here, Alexis. Alexis, we took her from the foundation, and we're very happy to have her, and Ed Bailey's not getting her back. So Alexis or I can always answer your questions. Okay, so your retiree dental benefit. All retirees and their spouses are enrolled in MetLife Dental, regardless of which plan you're on. So if you're on ARP or Highmark, you are on MetLife Dental. This is a separate contract from your health care plan. So it doesn't matter which option you're on, you're always covered under MetLife. Let us know if you need ID cards in a book. Alexis has them in the back. She'll be glad to give you one. The coverage is under the retiree's name and social security number. Additional information, again, on MetLife can be found on our conference website. Go to the retiree section. Keep in mind, this is not a very comprehensive benefit. It's mostly for cleanings, fillings, and x-rays. So, the UPMC Highmark Consent Decree. This ends June 30th, 2019. What does this mean for our Highmark members? This means that doctors that are contractually UPMC doctors can no longer see you. This also means that if you try to utilize UPMC facilities and you remain on Highmark, you may be asked to pay 100% of the cost up front. Okay, here are our conference-sponsored plans. Again, these are the plans we subsidize. So for 2019, we're pleased to announce a UPMC Medicare Advantage Plan for life. As a conference board of pensions, we went to the drawing board, we looked at this, we wanted to do whatever we can that was in the best interest of our retirees. We have 151 retirees over age 85. We looked at an exchange. I personally felt it was an unfair thing to do to people in their later years of life. What we decided was to just continue offering the plans we offer and to offer a UPMC option for those of you that want to remain utilizing UPMC doctors and facilities. No, that's not me, thought it was me. Okay, so these are your options. We have a PPO standard option, which is very similar to your Highmark high option. So what we asked these providers to do was try to mirror what you have. So we asked UPMC, offer us something that's comparable to our Freedom Blue high option. So UPMC gave us the PPO standard option. We asked them to give us a basic option, and again, there's an HMO option. With the UPMC for life plans, these are good plans. The HMO is a great plan because you have to stay in the UPMC network, and guess what? You already have to anyway. If you look at the benefit grids that are in the back, I would ask you to pay attention to the Part D prescription drug coverage. That's where it gets you. If you need a high level of Part D coverage and you want to remain on a Medicare Advantage plan, then your high option is going to be the way to go if you find yourself going in the donut hole. If you don't go in the donut hole and take mostly generics, the HMO or the low option for UPMC could be a great fit. Also, the UPMC plan will offer silver sneakers in 2019. It does not this year, but it is a new feature for 2019. Then we have our Highmark Freedom Blue plans. With these, you can live anywhere in the country. We have the Freedom Blue high option, the Freedom Blue low option, and the Community Blue HMO. Again, HMOs are good plans, but you have to stay in that narrow network, which would be a Highmark network. Those are our options. For 2019, what Highmark has also done is added a great hearing aid benefit to people that may need hearing aids. They have a new company called True Advanced. And in essence, what Highmark is telling me is that instead of a $500 allowance for hearing aids every 5 years, they've partnered with a company called True Hearing. With True Hearing, the benefit can be $4.99 or $7.99, whether it's an advanced or a premium. This information is on the back in the Highmark benefit grid. In the back on the Highmark benefit grid are all three plans: your high option, your low option, and your community blue. Again, the difference in pricing is going to be your Part D prescription drug coverage. Don't take a lot of drugs, you're probably fine if you're low in the HMO. Pay attention to your quarterly statements you get from Highmark. You'll know if you're getting close to the donut hole or the coverage gap area. Also with Highmark, this is a great time to be a consumer because everybody wants your business right now that the two giants are battling each other. So what has Highmark done? They want to keep you. They came back to us and said, we'll reduce the rate for next year. So what we've done is we're passing it along to you. So in 2019, the Highmark rates are going down. And those rates, I think I did not print the page, I believe, Alexis, do you know the Highmark 2019?
Yeah, they're on that snapshot. The Highmark are high will be 189, low 134, and HMO 63 per person per month after the subsidy.
Right, and in essence, what this works out to be is 2 months free premium. So if you like Highmark, you want to stay with Highmark, it's a great plan. The rates are low. It is a loyalty discount, so please don't get used to it. They're just trying to keep you in there, okay? So with the UPMC plans, they want your business as well. What are they doing? They're matching Highmark rates, but not the 2 free months premium. So the UPMC rates for 2019 will match our current Highmark rates, which are $226 on the high option, $160 on the low option, and $75 on the HMO plan. With your Medicare Advantage plans, they are different than a Medigap or supplemental plan. With your Medicare Advantage plans, everything is included in the plan. Just like a PPO works when you're an active employee. Your prescription drug, Part D coverage, hospitalization, specialists, skilled nursing, durable goods. Everything with the Medicare Advantage plan is included in the plan. You pay one price regardless of your age or anything else. We also offer ARP, which is a supplemental Medigap plan. With AARP, it is a good plan. You can go anywhere you want. However, with AARP, you pick and choose your options. You also must purchase a Part D prescription drug plan. With AARP, these plans may not be as rich as the Medicare Advantage plan because, again, you pick and choose your options and you buy your Part D prescription drug coverage. Also with AARP, there's no coverage gap if you get in the donut hole. So if you go in the donut hole and take high dollar drugs, I would tell you do not go for AARP. Also with AARP, it is impossible to give you pricing. Why? Because they rate you at the postal zip code you live at, the age in which you go into the plan, and the options that you choose. And again, ARP will bill us the subsidy, we bill you, and they direct bill the difference. So the conference doesn't bill in this scenario. Okay, other important information for you. Our open enrollment ends on November 30th. Please let us know if you're changing your plan for 2019 by the 30th. You must go through the enrollment process, so you can't just call us and say, yes, switch me. Because this involves Medicare and government funding, you must fill out the application, sign it, and send it in to the provider. One plan cancels out the other, so you don't need to call and let your other one know you're canceling. With Medicare, one will always cancel out the other. So please make sure you go through the enrollment process, give it 2 to 3 weeks as it must go to CMS first, which is the Center for Medicare Services. Fill out your application, get it in the envelope, either email or call myself or Alexis and let us know what your decision is so that we know to change your billing around based on what plan you receive or decide to go with. Also, another thing is you may receive a lot of material in the mail. I'll have people call me and say, hey, I got this kit in the mail that I can pay $0 a month. I always tell people throw it away. You may sign up for a plan that pays $0 a month, but the thing with healthcare is you either pay on the front end or on the back end. So they're going to get you one way or another. What I would ask you to do if you are looking at a $0 plan, these are not as rich as employer plans. So up front you may not pay much. If you get sick, you may be in trouble. So that's what I always caution people on. They are solicitations. The upfront costs can be very attractive. On the backside, it can be very costly. If you don't need to change plans, there's no action necessary. If you want to stay where you're at, you're happy where you're at, then you don't need to do anything. But if you are going to change plans, please communicate that to us so that we will be able to change your billing and look for that change on the enrollment file we'll receive in January. So the next steps. If you want an AARP kit or a Highmark kit, well actually the Highmark kit, the guy just showed up, so we have those kits. AARP kits have to be ordered directly from AARP. If you decide to look at our AARP, please keep in mind that kit needs to say Employer 56, the United Methodist Church. If it says anything else, you're signing up for a plan that is not ours, and we do not subsidize other plans. So that's why I tell people, you get these solicitations, they call me, they get confused, throw them away unless they're our plan. Okay, because that's where people get into the wrong plan, and again, we don't subsidize those. Also, we want to connect with you. If you would like to receive a monthly email, wellness tips, things of that nature, we have a sign-up sheet in the back. And also, we do want to stay connected. So we're hoping that you want an email from us. We send a lot of them. A lot of people don't read them on the active side, but we're hoping that you do want to receive an email from us and we can stay connected. So if you choose a UPMC or Highmark plan, because the conference does direct bill, keep in mind, we bill in December for January. We are always billing a month in advance. So if you're having automatic payment or a Keystone, bring over your check, or your bank electronically transferring the funds, or Vanco through the conference center, make sure you adjust that rate for 2019. And those of you who are going to remain on Highmark, that rate's going down. So make sure you make that adjustment, and then you should be good to go. Lastly, are there any questions? Yes, sir.
Can the husband go on one plan and the wife go on another?
Yes, yes, thank you, that's a great question. Yes, you do not have to pick the same plan as your spouse. Remember, once you sign up for Medicare, you're individual subscribers for the rest of your life. You don't have to choose the same plan as your spouse. You can go with, one can pick ARC, one can pick Highmark, it does not matter. Yes, ma'am.
You had mentioned you can pick the Highmark one, that's, you can live anywhere in the United States, is that correct?
Yes, because it's a Blue Cross Blue Shield product.
What about UPMC then?
No.
So if you are traveling, you go somewhere, you might be a little bit of.
Well, here's the thing. No matter what plan you pick, if you get sick and you are not within where you live, some people go to Florida for the winter and things of that nature. If you get sick and it's an emergency, it's always covered no matter what. It doesn't matter what plan you're on. But if you decide you're gonna live in Florida in February, March, and April, and you just go to get a wellness visit, that will not be covered. So keep in mind, on any plan, you are always covered. It's just that it's an emergency, it's not for routine visits, okay?
Do you have the forms here, if you're switching from Highmark to UPMC, do you have the forms here for us?
Yes, you can enroll today. We did bring kits, and Alexis is gonna manage the kits for us because we do have limited kits, because these vendors are all not getting their materials to us, and we don't wanna give them out unless people want them for other clergy that may want to sign up that did not come today. Yes.
My mother is a Highmark person. She's being treated for cancer. She now has to go to Hillman in Shadyside, which is UPMC. So we are anticipating having to change, but can they deny her because she has cancer?
They can't deny her, they can ask her to pay 100% of the cost up front. So this is what I tell people, because we've been getting these calls. If you see UPMC doctors, and you do not want to change that relationship, then you need to change plans. If you utilize UPMC facilities and you want to continue using UPMC facilities, you need to change plans.
But
Yes, ma'am.
what do you mean pay 100% upfront? I don't.
What they can do is when she goes in, they can ask her to pay 100% of the bill up front, and then file it with her insurance provider.
Is that after June?
If she stays with Highmark.
No.
Yes, after June.
She wants to stay with her UPMC oncologist, but can UPMC deny her changing to them because she is pre-existing?
So is she, no, there's no pre-existing condition clause. If she's staying with Highmark, is she gonna pick up UPMC?
She wants to. Yeah.
Okay, so she's fine. There's no pre-existing condition clause. That went away with the Affordable Care Act. Yes, ma'am.
I had this question because I'm on a treatment for cancer too, and I called, this is in Uniontown, and it's through the Hillman Cancer, and I asked them if they was going to still accept the Freedom Loop, and they said yes until 2024, they will accept, so.
And that could be very true, but the articles in the paper are stating UPMC is gonna require Highmark members to pay up front, and then file the claim with the provider. What I would recommend doing is if you're on Highmark, confirm with your doctor. Some doctors are independent, and you could be fine. If your doctors are independent of UPMC and you're utilizing Highmark facilities, you're fine. But if your doctors are contractually UPMC, they're not gonna see you after June the 30th, if you remain with Highmark.
I live in Mercer County, and I checked it out with my UPMC doctor, and I was told that they will continue to keep taking my Highmark.
He's probably an independent doctor if he's telling you that, because if they're contractually UPMC, meaning there's the big purple letters on the building, after June 30th, 2019, you will be denied services.
I got a letter that was mailed to me that the end of December was the last that I was gonna be covered.
Some may, some may.
I have a question. My husband is on dialysis.
Mhm.
Which
So the question, Diane, is he taking high dollar drugs? If he's taking high dollar drugs and he's gonna go into the donut hole, then you're gonna want the high option.
The high option.
Because what it does, you still go in the donut hole, but when you get to that donut hole, your co-pays are less than if you're on a lower option plan.
So we need high.
I would recommend it, yeah, and we can talk afterwards, Diane, okay? Brian?
I'm switching to UPMC, do I have to switch on Express Scripts for the mail order prescription drugs?
It would be on those grids that we have. I'm not sure who the provider is, it may be Express Scripts, because that's who we have on the active side, but I'm not sure. It would be in the,
I
books
can't
that we
find
have
any
in
place
the
on the
back.
website for Express Scripts that you can switch, what your plan is, that they just pay it.
I don't know,
How they get information I'm on Highmark now, how do they know now?
because of your, member ID, that identifies your plan, okay, because you would be in the system.
Have you heard that they're going to maybe get rid of the donut hole in the near future?
There's been some talk about that, but right now it still exists.
Would you describe again the HMO nuances?
So the HMOs have changed a lot over the years. When people were talking back in the 80s and what they were like, but HMOs are great plans. The thing that's good about HMOs is that your costs are lower because you're staying within network. You have to stay in network with HMOs. But the Part D coverage is the same. So if you can stay in network on an HMO, which you have to anyway with UPMC and Highmark and the ongoing battle, an HMO is a great plan. It's a good level of Part D coverage. It's really the same as the low option. It's just you must stay in network. And the enrollment kits that we have for Highmark outline the network, and I believe the UPMC one may also outline it. But as long as you're using UPMC and you're in an HMO, you're in network. Same with Highmark. If you're utilizing what's referred to as a community blue network, you're in network. The Part D coverage is pretty much the same as the low option on both plans. It's just you're in a narrow network. Linda?
Just want to confirm, the HMOs do include emergency treatment if you're traveling.
Every plan includes emergency treatment. Yep. Yeah, that's where people get confused. They think, oh, if I go somewhere, I'm not covered. It's not true. If you're on any plan that you're on, you are covered 100% if it's an emergency, as long as you're not going for routine visits and testing. Okay? Yes, sir.
I have two other questions. One, is my formulary gonna change on the, medicine? If I go from, the Highmark to the UPMC? And the second is, if I go to the UPMC, am I gonna be denied to some hospitals that aren't UPMC? Because I heard this happen to one of the patients in my, church. They said they finally made a deal that they weren't, but is that gonna happen? Am I gonna have just the opposite than if I stayed with, Highmark?
So with the first question,
The formulary, what
the
medicines
formulary
they're paid
can,
for.
the formulary can change with different providers. So the UPMC formulary would be in our enrollment kit in the book. So I would tell you to look at that formulary because they can be different with different providers. Okay, then in terms of being denied, it really depends on the facility and where you're going. We have a list on the UPMC ones of places that are in network. Some of the hospitals are what I refer to as independent or neutral. I believe Exala and what's the one in Johnstown? Heritage Valley, Conemaugh, those are all, you can use either or. And I think Butler is too.
What about James? I think James is.
I'm not sure, we'd have to check into that, but I can check into that, Bill, and let you know.
What about in Indiana, the hospital in Indiana?
I would ask you to look, give us the names. They're also on the sheet we sent out when we sent out the open enrollment letter. If you go to the last page of that, it tells you what hospitals remain in network. So we could find out the list of, if it's a specific one you're looking for that's not on the list, let us know, and we'll find out for you. Yes, sir.
Highmark has been really excellent.
there's no deductible, but there is the Medicare deductible every year, that remains the same. But, no, that's the beauty of the Medicare plans, is there's no deductible. Yeah, and they are good plans, I just wish the two could play nice with each other, I like them both. Yes, sir.
I'm trying to understand what the difference is between the high and low.
It's your
options
Part D
of
prescription
Highmark.
drug.
And
The
that's
Part-
the only thing.
Yes, sir, pretty much. You may pay a different copay, $5 here or there, but the high option is for people that go into the donut hole. If you don't go into the donut hole, you're paying for something you don't need. And keep in mind, generics are the same in the donut hole, so if it's generics, you're fine. Okay?
Where does Allegheny Health fall in this?
That's Highmark. Yes, sir. Yeah. Yeah. Anybody else? I know it's confusing. No. We would have to look. Yeah, I mean, because for the PMC, it's Hellman, and for Highmark, it's probably gonna be HEH, but I don't know. I know Cleveland Clinic is in that work with PMC. But I'm not sure about cancer centers in Monroe. Are there any other questions that we haven't answered, Brian?
Since the HMO is locked into that work, if I'm in UPMC HMO, can I go to Heritage Valley Doctor?
I think so, we'd have to check, but I think so. But I'd have to verify that, so let me circle back to you on that.
First time I've heard that piece of information, just wondered if that's.
Yeah, let me look into that for you, and I'll shoot you an email.
Did you say that the HMOs have relatively low drug coverage? So if you're using a lot of drugs, you're probably better with something other than HMO, is that right?
Yes, sir, that's right. So if you pick the HMO, it's similar to your low option on both plans, it's just a narrower network. So if you need that high level of Part D prescription drug coverage, you don't want to go on an HMO. The other thing to consider is you should be getting quarterly statements from Highmark that tell you how much you've spent in total drug costs. I always tell people pay attention to that. If you're getting close to the donut hole, you might want to opt up for the next year. If you're not close to the donut hole, then you should be good. You should be covered. So pay attention to those, specifically in the fall.
It's an annual enrollment that you could transfer from one to the other.
Yes, ma'am, that's correct. So every October we do open enrollment. If you pick a plan and sign up for it January 1 and you're unhappy with it, every fall you have the ability to change plans. Okay, so you're only locked in during January 1 to December 31st. Yes, sir.
For the newbie in the room, what's a donut hole?
So the donut hole is it's really complicated.
Oh, great.
So what it is when you've paid and the plan's paid a total, I believe it's $34.50 in total drug costs. You have co-pays. Once you get to, I believe it's $34.50, it could be different, then you go into a different tier of paying for drugs. If you get into that tier and you're on the low option and you're in the donut hole, you could be paying higher costs. For instance, a drug could be a $20 copay, you get in the donut hole, and 60% of the cost of the drug. So if you take a lot of drugs, you really need to pay attention to that. If you don't take a lot of drugs, you're fine. But a lot of people take high dollar drugs, and that's why pay attention to your statements. But that's the donut hole. You're in a period where you move up to a higher cost of drug costs.
That's our cost?
Yes, yes.
Not the,
That
okay,
is your
thank you.
cost, right.
And Alexis was very kind and had AARP send me a kit.
Yes.
They offer several plans.
Mm-hmm. Right.
Do I have a choice of that through the conference of the different plans?
If the kit was from us and it's employer 56 to United Methodist, if Alexis ordered the kit and that kit says WPAUMC United Methodist employer 56 and it is our ARC kit, but pay attention to that Part D prescription drug coverage with ARC. Because there is no donut hole coverage, meaning if you go in the donut hole, you pay a lot.
Thank you.
Yes?
We're being told at Asbury Heights that if we do not have UPMC by the middle of next year and need to go in nursing care, they ship us out.
To another facility.
That's so nice of them.
Yeah,
How Christian-like.
no, that went away.
I know, and our frustration is, it's like a little kid on the playground, you can't touch my toys. And the consumer's stuck in the middle of it. And I feel bad, I feel terrible, we have people calling us, and it just, to me, if it involves Medicare and government funding, it should be illegal. Yes, sir.
You can't get the ARP, complete coverage.
Yes, you can get complete coverage, but a supplemental, a Medigap plan is different than a Medicare Advantage plan. Medicare Advantage plan, everything's included. With an AARP plan, you're gonna pick and choose your options. So you pick and choose what plan you want, just like this gentleman said he had a kit. There's different options you can pick. ARP can be a good plan, but a lot of people need a higher level of coverage, especially on that Part D. With the ARP, you're gonna pick and choose your options. You're also gonna purchase a Part D prescription drug plan.
On the complete plan, if I can get that, the agent I'm talking with says my premium would be $93 a month.
Yes, and you're gonna lose the subsidy,
Well, yeah, but $93 a month, who cares?
but again, it depends on what options it covers.
They're pretty close yours.
Is it a supplemental or is it a Medicare Advantage?
It's a complete coverage
I
plan.
understand, but there's different,
It isn't supplement, it carries the whole thing, dental. and
so it's a
hearing aids.
Medicare Advantage plan.
Yeah, well,
Why don't you show me afterwards?
they don't call it that, and I don't, it's called the Medicare Complete Plan 3.
Sounds like a Medicare Advantage plan, actually. I mean, a supplemental.
We'll talk. Thanks, Kathy.
Sure, yeah, I mean, you're free to look at other plans, and that's what I tell people, but what I would recommend, if somebody's trying to sell you a product, they're making money on it, and go to our website and look at the benefit grid, ask them for the benefit grid, go to the website and compare the costs. Compare the UPMC, compare the Community Blue, or the Highmark plans, and see what your costs are for different things, because you're right, it can be cheaper on the front end, but it can be more expensive on the back end if you get sick.
But, so what you're telling me is, I probably can't get the Complete Plan 3, I can get the Medigap plan.
If you go with that plan, you lose our subsidy.
I understand that.
We can order you a kit and then you'll see all your options.
Yeah, I mean, that's what I would do.
And the complete plan might be on there.
Because I don't know what you have there, I don't know what you're looking at, so I can't really answer those questions, okay? Is there anyone else? Bill?
Yeah, now, the PPO basic, for Highmark and Community Blue HMO, the only difference is standards. The only difference is just staying that way,
Right, right, that's the biggie. That's the biggie is, with those HMOs, they're good plans, but they're gonna want you to stay in the network. And if you're not sure of the network, but you're liking the plan, but you're not sure, let us know and we'll look for you and see if the providers or facilities you're wanting to utilize are in there. If it's Highmark and it's a Highmark facility, you're probably in network, the same with UPMC. But if it's an independent one like Heritage Valley and things of that nature, we would wanna confirm that for you. Diane?
We have a situation where, St. Clair is near where we live. And that would be something especially important to me.
I think St. Clair's in UPMC, isn't it? I believe St. Clair is UPMC. Okay, so, yes, just don't pick up an HMO, just use one of the. Are there any other, yes, sir?
I retired from the conference, I think, in 2001. My wife and I chose the AARP, and I'm here to tell you, there's not a happier person in the world than my wife and myself. My questions come from a different direction. Does the conference subsidize each one of these plans at the same dollar value?
Yes.
Number two, going forward, how much does the conference's health and welfare ministries see being available for subsidizing these plans? In other words, is the number that they subsidize with likely to go up? Or is it locked for the next 10 years?
The number is not locked. I've been here since 2008, and I've only seen it go up once since I've been here.
So the chances are it probably won't be going up.
Probably not anytime soon because of the cost of healthcare.
Yeah.
I wouldn't, but I can't really answer that, but it hasn't in 10 years, but one time gone up. Everyone does receive the same subsidy, and it'll probably stay that way for a while, so to ensure that we can continue to offer subsidies to our retirees and their spouses.
Well, there's not enough time in this meeting for me to tell you how pleased I have been with my medical coverage. I've had exotic surgeries, most of them at Cleveland Clinic, but some at Cedars-Sinai and everything. So far, my wife paid $5 for an evening meal tray, and that's been it, paid to any hospital in my whole experience.
Right.
And can you tell me what the ratio is or between people going for, I would say, these locally focused plans, UPMC and so forth, vis-a-vis the AARP? Are half the people on it AARP?
It's about half and half. When I first came here in 2008, they offered ARP because clergy had retired and wanted to move outside of Western Pennsylvania. That was their only option. But with the Highmark plans, the Blue Cross Blue Shield is now nationwide, so now you can live anywhere and have those plans as well. I would say it's 50-50, and you're right with ARP. It can be a great fit for people that don't need a high level of Part D coverage. Some people will call and say, I pay next to nothing. I had one person tell me, if you sign up for an ARP membership, they throw in vision. But again, with the Medigap plans or supplementals, which AARP is, you're rated on your age you go in, the options you choose, and your postal zip code, and you have to buy your Part D coverage. So for instance, for you, if you went in at age 65, you're rated differently than somebody who may look at it at age 75 and say, well, I'm gonna look at that now. The rate is gonna be different. But they are good plans. It's just a matter of individual needs is what I tell people. It's what are your individual needs? If you don't need that high level of Part D and you wanna go wherever you wanna go, then ARP would be the way to go.
Well, I'm a happy camper.
That's good to hear. These are all good plans, and that's why it's so hard to, people say, well, what plan should I go with? It depends on your individual needs. Do you take a lot of prescription drugs? Do you need, some people want that higher level of coverage with skilled nursing is in there. The durable medical goods are in there. The Part D is in there. Vision, silver sneakers, hearing aids. Which some of those things you may not have with ARP. So again, I would say compare them. Look at those grids when you compare though, because if you have different needs, then it might not be a good fit. Yes, sir.
Would you give an example of how in-network differs for PPO and HMO? You stressed that you're locked into HMO in-network. Aren't you also in PPO?
Pretty much now you are. That's why I would go with an HMO, because they're not playing nice. But again, that may kick you out of places like Excella facilities on an HMO, Heritage Valley. So the independent hospitals and independent providers are where it's gonna get you on an HMO. Okay, does that make sense? Linda?
You may have just answered it, but I want to confirm. An independent doctor who accepts both UPMC and Highmark, are they considered in-network or not?
For an HMO?
Yes.
Probably not.
Okay.
But if you want to look at an HMO again, and you say, well, I see this doctor, don't want to part ways, let Alexis or I know, and we can find out for sure if they're in network. But an HMO is probably 99.9% of the time, if it's UPMC, you're gonna only have to utilize UPMC. If it's Highmark, you're only gonna be utilizing Highmark doctors and facilities. That's the difference of an HMO, but because it's a narrow network, it saves them money, and they pass that money along to you. They pass that savings along to you.
I just had one last question. I don't know if it's my impression because it's happening to me, or in a 50-mile radius, would you say that most hospitals are going UPMC now? Because that seems to be what's happening.
No. Highmark is
You drank the Kool-Aid.
standing up to the bully on the playground. So what they're doing is they're building hospitals north, south, east, and west. So they are, they're gonna compete with them. And good for them. I mean, they're both great health systems. The thing that troubles me is we have world-class healthcare here. We really do. I've lived in many places. We have world-class healthcare, and it would be so nice to see them both work with each other instead of this constant ongoing, because it just affects the consumer. Is there any other questions?
Can I ask something?
Sure, Alexis, go ahead.
I've just been listening, and there's lots of questions about doctors and facilities, and do they accept this or that or the other, and like Kathleen said, we're more than happy to reach out and ask questions, but that doesn't mean it won't change next month, or in 6 months, or in 10. Those facilities, those contracts have money, and they'll do what they need to do. And there's nothing we can do about that. So I guess my point is to say, with the HMO, it puts more of the responsibility on you to continue to make sure that you're using the in-network. And you just gotta really stay in front of it so that you're not surprised, and have a lot of communication with your providers and your facilities, because we can't guarantee who's gonna stay where.
Yeah. And I have some people, when they retire, they said, I'm gonna go with the HMO because I'm moving to such and such place, it's in network, I'm gonna have to get all new doctors anyway, I'm doing it. And they love it. I haven't had anybody go on the HMO that's come off of it, except for one person because she moved to Ohio. That's it. So, it's a matter of preference.
Previous communication, there were some UPMC facilities approved by Highmark for next year. The current information does not have those. Are they now eliminated?
So on the open enrollment letter, is that what you're referring to? Because that,
Yeah, the letter said that, like, we live in Hermitage, and Horizon UPMC was approved for those of us with Blue Cross Blue Shield. But that's not on the current, sheet that, is over on the desk.
I only printed the first page just to save resources.
So it may
It's
still
still
be
the same
approved?
as far as we know. I can get you that other page if you'd like.
Okay.
and it's on the website. So all of this
So much.
information is on the conference website. And again, if you're not sure what to do, compare those grids. Go online, look at the grids, look at the things that are most important to you. The Silver Sneakers is both plans. The hearing aid benefit with Highmark is gonna be a really good benefit, and they dropped the rate. So it's really a matter of individual need and preference. Any other questions?
Hey Kathleen, thanks for what you do.
Oh, thanks,
Thank you,
Tom.
Alexis. You know, this is a great benefit to us, and it, you know, it takes a lot of juggling, and you guys get a lot of, you know, heartache and care for that.
Thanks, Dawn. Well, I feel like we have a responsibility here. We did look at an exchange. I cringed when I saw we have 151 people over age 85. I thought that would just be an awful thing to do, to pull the rug underneath people that are 85, send them a kit and say, here, pick a plan and go online. I mean, I helped my mother with her banking, and it's just not right. So I'm glad that, to us as a board of pensions, the solution was make a UPMC plan, and then people can stay where they're at if they like it. If UPMC, you want UPMC, it's there. Okay? Any other questions? Dawn, would you lead us out in prayer?
Lord, we remember that life is a journey, and we find ourselves in surprising places in the journey, but today we're here, and we're grateful for the people that care for us, grateful for the opportunities that we have and have had to serve, and grateful for those who serve us. I thank you for this group, and I ask your blessing and your peace, and allow us today to be in your care. Allow us to be encouraged by your spirit and by each other, and allow us to go in peace. In the name of Jesus Christ we pray, and all your people said.
Amen.
Amen.
Thank you, thank you. We're gonna stick around if you have individual questions. We'll stick around for a little bit. Thank you for coming, and let us know if you have any other questions. All right, so the decision is